The tiny white kitten was barely visible in the cardboard box left outside the veterinary clinic. Her blue eyes were completely sealed shut with thick yellow discharge, crusted so badly that it looked like she hadn't seen daylight in weeks. But what this family did next, and what happened during her recovery, would prove that sometimes the smallest acts of compassion create the deepest bonds. She found Luna on a Tuesday morning, not at the clinic doors like you'd expect, but abandoned in the parking lot behind a dumpster. The box was soaked from overnight rain, and inside, this fragile white ball of fur was shaking uncontrollably. The kitten's face was a mess. Both eyes swollen shut, matted fur around her cheeks, breathing labored and raspy. She looked maybe 6 weeks old, possibly younger. Definitely too young to survive alone. The first instinct was to take her inside immediately. But here's what most people don't realize about severe eye infections in kittens. They're not just painful, they're life-threatening. Without treatment, the infection spreads to the sinuses, to the respiratory system, and eventually, the kitten stops eating, stops fighting, and just fades away. Dr. Martinez examined her within minutes. The diagnosis was brutal: severe bilateral conjunctivitis with secondary bacterial infection. Both eyes were at risk. The tissue around them was inflamed and damaged. In cases this advanced, some kittens lose their vision entirely. Some don't make it at all. "This is going to be intensive," Dr. Martinez said carefully. "Eye drops every 4 hours, around the clock. Antibiotics twice daily. Warm compresses to clean the discharge. It'll take weeks, maybe months. And even then, we can't guarantee she'll fully recover." She looked down at this trembling white kitten, so small she fit in one palm. "Luna," she thought suddenly, "because even in total darkness, the moon still shines." If you're watching this right now and you believe that every creature deserves someone who won't give up on them, hit that subscribe button. These stories need to reach people who understand that healing isn't convenient, it's commitment. And you need to be part of spreading that message to everyone who needs to hear it. The first week was exhausting. Every 4 hours meant setting alarms through the night. 2 a.m., eyes crusted shut again. Carefully warm compress, gently soften the discharge, hold Luna still while applying drops. She'd cry, a thin, desperate sound that cut straight through. But slowly, gradually, the swelling started reducing. By day 5, a tiny sliver of blue appeared in her left eye. Just a crack, but it was progress. Real, visible progress. By day 9, both eyes were partially open. Luna could see shadows, movement, white. She'd track fingers moving in front of her face, her head turning to follow. But here's where something unexpected happened. Something that proved this wasn't just about physical healing. Luna bonded with the family's 7-year-old daughter, Emma, in a way nobody anticipated. Emma had been there from the beginning, watching her mom administer treatments, asking questions, learning to be gentle. And Luna, even in her pain, seemed to recognize Emma's voice specifically. Week 2 brought a moment that still makes the family tear up. Emma was doing homework at the kitchen table, and Luna, now moving around more confidently, climbed awkwardly onto the chair beside her. She couldn't jump properly yet, still weak from weeks of illness, but she managed it, then carefully stepped onto Emma's lap. For the first time since being found, Luna purred, a soft, rusty sound like she had forgotten how. Emma froze, barely breathing, afraid any movement would break the spell. Luna circled twice, kneaded Emma's leg with tiny paws, then curled into the smallest ball possible and fell asleep. "Mom," she whispered, eyes shining, "she chose me." By week 3, Luna's eyes were almost completely clear. The blue was striking now, vivid and bright against her pure white fur. She was gaining weight, her coat getting fluffier, her personality emerging. Playful, curious, mischievous in the way only kittens can be. But the bond with Emma deepened in ways that surprised everyone. Luna would wait by Emma's bedroom door every morning until she woke up. She'd follow Emma from room to room, a tiny white shadow. When Emma got home from school, Luna would be sitting at the window, watching, waiting. One afternoon, Emma was crying over a difficult day at school. bullying, the kind of casual cruelty kids can inflict without understanding the damage. She was curled up on her bed, face buried in her pillow, trying to muffle the sobs. Luna appeared seemingly out of nowhere. She climbed onto the bed, walked directly to Emma's face, and pressed her small pink nose against her cheek. Then she did something she had never done before. She patted Emma's face with one soft paw, gentle and deliberate. Once, twice, 3 times, like she was saying, "I see you, I'm here." Emma wrapped her arms around Luna, and they stayed like that for almost an hour. 2 souls who'd both known abandonment, both knew what it felt like to be dismissed as too much trouble, finding comfort in each other. Now, here's a question that divides people. Some believe animals don't truly understand human emotions, that we're projecting our feelings onto them, but others know from experience that the bond between humans and animals runs deeper than logic can explain. Which side are you on? Do animals genuinely sense our pain and respond with empathy, or are we reading too much into their behavior? Drop your thoughts in the comments because this conversation matters for how we understand and treat the animals in our lives. 4 months have passed from that rainy Tuesday morning. Luna's eyes are perfect now, clear and bright, tracking everything with that intense kitten focus. Her white fur is long and soft, and she's grown into a healthy, energetic young cat. But it's the relationship with Emma that defines Luna's story. They're inseparable. Luna sleeps curled against Emma's neck every night. She sits on Emma's desk during homework, occasionally batting at pencils, but mostly just being present. When Emma reads aloud for school, Luna listens, head tilted like she understands every word. Dr. Martinez called recently for a follow-up. She asked how Luna was adjusting, if the eye issues had fully resolved. "She's perfect," came the answer. "Honestly, I can't imagine our family without her now." There was a pause, then Dr. Martinez said something that stuck. "You know, we get about 3 or 4 cases like Luna every month. Severe infections, abandonment, critical condition. Most people don't take them. They choose easier adoptions, healthier kittens. I'm glad Luna found you." But here's what keeps Emma up at night sometimes. She thinks about that cardboard box behind the dumpster, how easily Luna could have been overlooked, how many hours she might have been there in the rain before being found. And she thinks about all the other Lunas still waiting in boxes, in shelters, in places where nobody's looking. What if they had driven past that day? What if someone else had found Luna, but decided she was too much work, too risky, too damaged? Where would she be now?